Hello, welcome to Module 6, Surgical Conscience. Every contamination matters. This week we will discuss the devastating nature of infection, why every contamination does matter, and the definition of surgical conscience and its role in the OR. The term conscience is defined as an inner feeling or voice, viewed as acting as a guide to the rightness or wrongness of one's behavior. There are a few things required for this consciousness. First, one must learn what is right and what is wrong. And second, they must listen to the inner feeling or voice that guides them to the rightness or wrongness of behavior. Let's start with what is right or wrong. Morals would be considered our benchmark of right and wrong. It is derived from the Greek word mos, which means custom. Morals are customs established by a group of individuals and are concerned with the principles of right and wrong. So a good way to think about this is that medicine has a custom to base right and wrong through research and science. Medicine has established a set of rules that are right and wrong, just like society has set rules and the laws that we all agree upon to follow. This is the same thing within medicine. For example, our AST guidelines, these are accepted as a basis of right and wrong in the OR, and it's based on research. Now, our inner voice is also considered our ethics. The word ethics is derived from the Greek word ethikos, which means character. Ethics defines the character of an individual. Ethics are related to the right and wrong conduct of an individual in a particular situation. Our ethics is that inner voice that tells us something is wrong and we must speak up or we must act. For example, while wearing a sterile glove, you touched your face on accident, but no one saw this happen. According to our rules of right and wrong within that sterile environment, this is a contamination. Your ethics or character will determine if you speak up to keep the patient safe or if you stay quiet so you don't draw attention to yourself. This is surgical conscience. Surgical conscience has been defined in a recent study as the moral obligation to uphold and defend surgical asepsis and perioperative safety, no matter the cost or consequence. And I want you to think about that, no matter the cost or consequence. This can be a matter of pride, where you have to admit that you made a mistake, that something went wrong, or fear of losing a job or getting in trouble at work or getting yelled at. That's what those costs or consequence. We have to make the right decision no matter the cost or consequence. So that means, as I said, we must establish an ethical standard that places the patient's safety as a priority over our own. That's a huge responsibility. And I realize that it's asking a lot, but it is an essential component of working in healthcare and specifically in the operating room. It's important to never forget the commitment we made to keeping our patients safe. Let's watch a quick testimonial from a patient who survived a surgical site infection. So I thought that was interesting. He said an ounce of preparation stops a pound of pain. That couldn't be more true in our situation in the OR. So one surgical site infection, that patient was able to survive his surgical site infection. But this can be a devastating experience. People can lose limbs, they can lose jobs because they haven't worked in months. So this is if one SSI, surgical site infection, can cause death or a devastating experience, it's important that we pay attention to contamination. So let me ask you, do you think a patient gets an SSI after one contamination in a procedure? How about after 4? Do you think it's after 20? How many microbes does it take to cause an infection? I'd like you to think about it like this. 2 patients come to the OR. We have patient A and patient B. Both look very similar in age and body habitus. What we don't see is that patient A is an elite athlete whose life focus is on nutrition and exercise. Patient B is a smoker who drinks excessively throughout the week. He rarely visits the doctor and has an underlying autoimmune disorder that he is unaware of. Although we cannot tell the difference between the 2 patients by looking at them or by looking at their chart, patient A has an extremely strong immune system that could fight off a great deal of microbes through contamination, while patient B has a weakened immune system that will struggle to fight off every microbe. So these lines are indicating how much you're going to see pictures rise here and how patient A could handle way more than patient B. So let's say both patients come to the OR, but housekeeping did not properly decontaminate the OR bed, leaving behind bacteria from the last patient. Now we have contaminations and microbes that are entering the body, but both patients can handle this. Their immune system can handle these levels of microbes. Now the surgical scrub forgot to check the chemical indicator. Oh, I'm sorry. The nurse was not properly trained on how to prep the skin and went from dirty to clean on the surgical incision. This left microbes in the surgical site. Now here we see another layer of microbes that entered the body, but we're both still okay. Both of their immune systems can still handle it. Next, the surgical scrub forgot to check the chemical indicator on the instrument tray, and it was not properly sterilized. Now we have 3 contaminations that we know of, and what it did was it was way too much for patient B. And now patient B, because whatever reasons within their body, within their ability to fight infection, they have acquired a surgical site infection. Now, patient A was able to walk away without a problem because his immune system was able to handle it. But what I want you to take away from this is we cannot tell who has the ability to handle what. So therefore, we need to make sure that we are watching every single contamination, that we got to stop this from happening in case in case the surgical scrub happens, or in case something out of our control adds to the microbes in a patient. So if it is impossible to know how many microbes will cause an actual infection, then it is essential that we assume that every contamination matters.